Welcome back. I'm joined by Senator Kim Pate, who's the author of Bill S-233, and we're discussing guaranteed livable basic income. It's such an interesting topic. I'm definitely fascinated by this. Before we went to commercial break, Senator, we're discussing sort of what exists already. And, at best, we can call it, I guess, a patchwork of programs. Could you maybe elaborate a little bit more of if somebody say has a disability, what benefits
Mhm.
are available to them, and how would that compare vis-a-vis to something that you're proposing with this framework?
Right. Well, right now, if someone has a disability, they may be eligible for the Canada Pension Disability Benefit, which is usually marginally more than the provincial or territorial benefit that may be available to people with disabilities. And so those resources are available. They're often still inadequate to meet the needs of people with disabilities, hence the reason that the federal government introduced a bill to introduce a disability benefit, which still hasn't rolled out yet. It may look like this. And in fact, when the BC, when the NDP government got in, they did a study on basic income and should they look at basic income in BC. And what's very interesting is just as Dr. Evelyn Forget, who studied the Mincome program, which was a project that happened in Manitoba in the 70s, a basic income, she said that basically what BC, the panel said, is the only people left out were people who, well, it was difficult to figure out who was left out because the BC panel said we should give a benefit to women fleeing violence, uh, First Nations who have issues, kids leaving care, people with disabilities, and there were a whole host of folks, and they talked about incremental approach, and they likened it to the building of a house and renovating a house versus starting all over. What we're proposing is that what we've seen is by adding on all this, as you identify them, a patchwork of programs across the country, every one of those programs has administrative costs.
Hmm.
Every one of them has different rules and procedures. If we could actually come to agreement on providing people with an income tested model, so not everybody would get money, but if we could provide income for those who are under a certain income. Now, it may be obviously would be different in downtown Vancouver than rural PEI, for instance,
Hmm.
but we could take into account different costs of living throughout the country, but streamline the administration of the cost component. And then, as many of the social workers I meet with say, then we would much rather be providing supports and services to people rather than policing people's income or morality, which is often what people are left to do, judge whether someone is deserving of, whether it's the dental benefits, the pharmacare benefits, all of those things. And so and one of the things some people have said, and that Dr. Evelyn Forget out of Manitoba has researched is, well, if we just do that, we'll create a whole community of layabouts. Now, that in theory is also what people said about social assistance when it was introduced. But the reality is, we know that only two groups of people stay home more when there's a basic income. And we saw it during the pandemic,
Hmm.
are people who can't work because either the work is not available and suddenly they have no work. And if they have an income and it enables them to either start an entrepreneurial business or to get better skills, go to school, get a trade, to get a better job, that is one group that stays home more when they have a basic income. Research has shown. The other group are people taking care of others. So whether it's their children, elderly parents, people with disabilities, presumably those are two groups we want to be able to provide supports for. And I think much like what happened in this country when Medicare was first introduced, everybody said, oh, it's expensive. It won't do what they're saying it'll do. It'll be socialism. There was all
Hmm.
kinds of, scary predictions. The reality is, even though we're seeing huge, huge cracks in our healthcare system, especially post pandemic. And we know that the cutting of services over the last several decades has meant that many people are falling through the cracks. No government is game to roll back Medicare in this country. And in fact, even though it's still inadequate at this stage, it's a model that's looked to internationally. And so I think this kind of guaranteed livable income for people would could similarly and in fact PEI has indicated they want to start it and they're waiting for the federal government to come to the table. I was up in the Yukon, as I mentioned, and And I met with many Yukoners, and they've come at it through a health lens, and so has
Right.
Newfoundland and Labrador, saying that one of the basic elements of ill health is poverty. That if people
Of
don't have
course.
the money to buy decent food, don't have the have housing, if they
Right.
don't have the ability to support themselves, then that is the number one determinant of health,
Okay, I'm
and
going to
and
pause you
certainly.
there. We're going to be right back after this commercial break.